Terry Hope,
Brittany Hope,
Marie Hope,
Bridget Hope,
Brianna Hope,
Matthew Tuttle.
imagine a little girl. She was born 2 weeks ago and has been feeling a sharp pain in her chest. Like any good mother, her mom takes her to the doctor, and to her surprise, her little angel has a VSD, a ventricular septal defect. The child's pain is from her lungs working harder, and her doctor tells her mother she may never get to run and play like all the other little girls in life. Now imagine that this little girl is your daughter, or your sister, or someone else that is very important to you in your life. This disease could happen to anyone, but being informed on the matter can cause a world of difference in how you can play a role in helping them. Ventricular septal defect. Ventricular septal defects are the most common of congenital heart diseases that exist. All over the world, people deal with this disease in different cultures and different ages. However, there is so much to this disease that people do not know about. First off, we will start with the basics. What exactly is ventricular septal defect? Secondly, we will cover what the causes of ventricular septal defects are. Then we will discuss the signs and symptoms that occur with this disease, as well as the side effects of them. Lastly, we will go over a cure for the disease and just how efforts for the cure have progressed over time. Now let's get a better understanding of ventricular septal defects, also known as VSD. So what exactly is VSD? Sometimes referred to as a hole in the heart. VSD is a heart defect for which a hole is present between the pumping chambers of the heart, also known as the ventricles. Over time, as people and societies change, the ratio of people with VSD changes as well. Overall, however, a few things have maintained consistent. Most people in this world who obtain this disease receive it at childbirth. According to the Adult Congenital Heart Association, also known as ACHA, about 1 in 500 babies are born with VSD. That's about 0.2% of 500 babies. Now that doesn't sound like a very large number, does it? But in the grand scheme of things, if you do the math based on the USA Today article titled "Birth Rate Among U.S. Women Rises for the First Time in 7 Years" by Jennifer Califas, that's about 796,000 babies in the year 2014. Overall, the percent of people in the world who live with disease is higher than all other septal defects. The disease is a highly known birth defect that is a hole in the septum that can gradually, over time, cause more issues with the heart. VSDs can range from large holes to small ones. Sometimes the small ones are not that great of a risk and tend to even close up by themselves. As you see, VSD is a very different kind of disease. Now let's look at the causes that make it so unique. The causes of VSD really entirely lies in the genetic makeup of the heart. As a baby, the VSD is formed in the stages of the development of the heart while they are in the womb. As the heart is forming, a wall is called the ventricle septum is formed in between the chambers of the heart. This chamber is what separates the blood that goes to the body from the blood that goes to the lungs. When the heart is forming, if the wall does not completely form, a hole remains in its place. Sadly, no one is really sure what causes this to happen, other than, as read in kidshealth.org in an article titled "Ventricular Septal Defect," that it seems to be a genetic disorder due to a missing or extra pieces of chromosomes. However, over the years, scientists have found that many diseases and defects have no clear cause. Now that we understand what the causes of a VSD are, let's make ourselves aware of the signs and symptoms of the disease. Just like any other disease, some symptoms can mean many different problems within a person, ranging from weakness, heavy breathing, heart murmurs, etc. A VSD is no different. Doctors make it very important to mothers that their child needs to have routine checkups within the first few weeks of life. These checkups are so important for a VSD because it allows the doctor to tell if the VSD will cause any symptoms or issues with the baby. To diagnose a VSD, many people go through chest x-rays, ECGs, and cardiac MRIs. Sometimes to really tell if the disease will cause issues requires waiting until later childhood, and sometimes even until adulthood. Everyday life with such a disease can be frightening. A heart murmur is caused by the blood passing from one chamber to another. The hole in the heart, at times, can even rumble with the whole chest. This is called a thrill. Life is possible with a VSD. Some people can even have a child with one, but it is highly suggested that the person see a doctor before getting pregnant to see and understand if they might have any complications during this process. Everyday life with a VSD can be a little scary, but as you can see, it is very doable. Let's now take a look at a life-changing topic, the cure. The large question that is probably the most important is there a cure? The answer is no. Not currently. Without knowing what exactly causes a VSD, we cannot create a solid cure or prevention method for it. Doctors, however, have found many forms of dealing with the symptoms and have even found ways to repair a VSD. Like any treatment for a disease, it all depends on the age of the person. Many aspects go into play for this matter. If the hole is small, generally the problem does not affect the child's life and physical activities. However, if the hole is larger, it may require surgery to fix it. Typically, surgery happens in the first few weeks of a child's life with a large hole. This generally leads to the hole being stitched up and having a patch placed over it, which will heal within a few months, causing no side effects typically. According to kidshealth.org, some special cases of VSD may require being fixed by cardiac catheterization. This requires a thin tube to be placed within the blood vessel, along with an implant like disc to be positioned in the hole in the septum of the form of the septum and close and fix the VSD. Although no cure seems to exist, doctors seem to have found a great way of combating the disease for the meantime. In closing, VSDs are bad news for people who want to live active, fulfilling lives. A VSD is a very common and well-known heart defect. Even with all the complications it can cause and the procedures that may be required to fix it, people may not know the causes and a cure may not exist. But at least doctors are trying and scientists have been working on it for years. The search for a cure may never end, but right now a semi-solution has been found, and the side effects that come with having a VSD can be controlled to a point that is at least manageable. Remember that little girl for the story? Well, she does exist in this world. You may not know her, and you may never will have to experience someone with such an issue. However, due to technology and intelligence, she will have a chance to possibly live a normal life.
Matthew Tuttle.
Terry Hope.
Brittany Hope,
Marie Hope,
Bridget Hope,
Brianna Hope.